The views and opinions expressed in the following program are those of the speakers and don't necessarily represent the views or opinions of this station, its staff, or management.
Sara at MiddletownCHC.org. That's Dr. Sara, S-A-R-A, Saturday morning at MiddletownCHC.org. Dr. Little is a board-certified pediatrician at Middletown Community Health Center's Port Jervis Center for Pediatrics. Every Saturday morning at 7 a.m. on WYNY, Dr. Little and her guests will focus on children and families, parenting, family relationships, and healthy lifestyles. Today, Dr. Little's guest is Dr. Manny Martakis, board-certified pediatrician at the Port Jervis Center for Pediatrics and columnist for the Times-Herald Record. And now, Dr. Sara Little.
Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara. And I'm very pleased to announce that our guest again today, he's a board-certified pediatrician, also practicing in Port Jervis. He's my colleague, friend, and partner, Dr. Manny Martakis. Welcome.
Thank you, Sarah. It's great being back.
Good. I'm glad to have you back. So today we're going to tackle on seasonal allergies. So what is your take on seasonal allergies, Dr. Martakis?
Well, seasonal allergies, unfortunately, I have to start with to say that we live in a very bad area for seasonal allergies. The entire tri-state area is filled with forests. We have a lot, it's wonderful to camp in, it's wonderful to look through, but unfortunately, to live here, people can be subject to all sorts of pollens and all sorts of environmental allergies. You've got the trees in the springtime, you've got the grasses during the summer, also with the molds, and you've got the weeds during the fall. So you've got a lot of stuff here. Also, you get a lot of stuff that blows in from the west, and also you get stuff that also comes in from the Hudson River Valley. So we're almost like in one big allergy sink here, and it makes life pretty miserable for people who suffer from allergies.
What are some of the allergies that we're commonly seeing in the office?
Well, for the most part, the big thing that we've been seeing now is a lot of what we doctors call allergic rhinitis, but what it's basically called hay fever. It's your usual seasonal allergies. Its symptoms can include runny nose, nasal congestion. You've got the itchy eyes, the watery eyes. Sometimes you can get a cough. Usually the cough is more prevalent during the nighttime, and if you're waking up with this nasty hacking cough, it seems to go away for the rest of the day. This is what our definition for hay fever. And now we're starting to see it right around between the beginning of March to April, and you start to see this onward throughout the whole spring season. For some people, unfortunately, they can have seasonal allergies all year round, and that makes life especially miserable for some people.
So what type of things are we seeing this spring? What have you seen so far in the office?
So far we've been seeing a lot of the hay fever. We've been seeing a lot of kids, unfortunately, a lot of children with asthma. Also, this tends to complicate the problem. And sometimes their asthma can get set off also by allergies. So that also leads to a complicating factor that we have a large number of children with asthma that we've been seeing.
Yeah, and once that pollen hits, that's when the asthma attacks start.
Absolutely.
And especially with the nicer weather that we've been having.
Oh, absolutely, absolutely. And this winter has been an especially bad one. Not so much with regard to the storms, but just with precipitation. Lots of snow means lots of water for the trees. And if they have lots of water, then the trees can produce a lot more pollen.
Oh, yes.
And that just makes things all a lot the worse.
Oh, yes. So with allergic rhinitis, what are some of the common treatments that we use for that?
Well, you usually start off with some sort of an oral medication. Something like an antihistamine like Claritin or Zyrtec is really good.
Do you advise over-the-counter?
Yes, I usually do, especially in the beginning. If the child has very, very mild symptoms, then I would definitely recommend that. If that isn't controlled with those kinds of medications, then we sometimes go to something that's either a nasal steroid that is also that's prescribed. That's not over the counter. That has to be prescribed.
And what are some of the more common nasal sprays that you use in the office?
Usually Nasonex or Flonase. Those are usually the two big ones.
Do you have a lot of kids who are compliant with nasal sprays? Because I can't imagine putting anything up my child's nose and having him actually sit there.
No, unfortunately not. And so usually we also have to consider the age of the child.
Right.
A 3-year-old is never going to be able to take a nasal spray. Someone who's older, though, say 13 or 14 years old, a teenager, is a different story. So for the younger children, sometimes we try to go over with a medication, something like an anti-leukotriene inhibitor like Singulair is good. Those are also good medications to give as well. Other things that are much more over the counter include nasal saline rinses. Those also work very, very well.
Are you talking about something called a neti pot?
Yes, the neti pot is good. That's one of the examples. They also have bottles with nasal saline that you can basically squirt up the child's nose. Those are at least a little bit better. And so I know, once again, it's also age-related, too. A lot of the children
to
don't
just really dry out the nose so that you don't have that post-nasal drip that occurs, which then leads into the cough. Precisely.
Another thing, too, that I also recommend, get a humidifier for the child's room. That also helps to make the air a little moister. And with the moisture, then the nasal cavity, which acts as a humidistat for the air that you breathe in through your nose, tells it to shut down on the mucus that it needs to produce in order to make the air more moist, since you're already doing it for the child's room already. So hopefully that it helps the child's symptoms at night, especially when the child's producing a whole bunch of mucus at night.
How do you treat our patients who have both asthma and seasonal allergies? And when do you actually start the seasonal allergy treatment?
It gets a little ginger on that one, because unfortunately, for some children, their asthma is relatively well controlled and it's just set off by the allergies, then it's just a matter of trying to control the allergies before they start. So sometimes I would recommend my mothers and fathers to actually start the children on the medication right around from March to April, and to just get the ball rolling before their symptoms really start to start up.
Oh yeah, completely agree. What about those parents who refuse to give the Singulair until the actual start of...
Not much we can really do for that. Unfortunately, we just have to be able to make sure that there are other medications that the child needs for his asthma is also available. There's inhaled medication that we usually give as a rescue medication. It's called albuterol. That's our usual standby. So we also make sure that they're stocked up on that, because unfortunately that can turn into a big situation later on. I mean, unfortunately, with allergies and hay fever, about 10% of all the children in the United States have this problem. So it's definitely a very prevalent issue. But other things also cause hay fever too. You can also have animal dander, cat dander, dog hair.
And is there testing for that?
Yes, there is. There's blood tests that you can use for that. There are also special skin tests that are done by trained and certified allergists that look for these sort of things.
So at what point do you recommend our patients to see an allergist?
Well, I would say that if the child's symptoms are not being controlled by regular medication, over-the-counter medication is not working, prescribed medication from the pediatrician is not helping, and the child is still miserable, still having a lot of symptoms, then definitely going to see an allergist will be an important next step.
Is there a connection between allergies and inflammation?
Yes, there is. Basically, the way allergies work is that it's the body's way of dealing with something that it deems foreign. And unfortunately, inflammation is the way the body reacts to anything that's foreign. So that even with something as what looks benign as pollen, the body will react with inflammation in the nasal passages, inflammation in the tonsils and the adenoids sometimes. And that's just the body's way of reacting to different kinds of diseases.
And that's really why we would add a nasal steroid to help combat that process from happening. Precisely.
Sorry.
That's all right. But speaking of nasal sprays, specifically nasal steroids, do you ever notice that they stop working after long-term use, or are they pretty effective throughout?
Sometimes it depends on the child, too, because for some children, and for the most part, most parents, they don't want to keep their child on a nasal spray for a long time if they don't need to. So for a lot of times, all they need is about maybe 2 or 3 months of use, and then they have to stop. Some parents, I find, maybe a few weeks through their worst season, they need the nasal spray, and then they stop. And if that's the case, then usually they can be able to return to the nasal spray whenever they want to. Other children that require it for longer-term use, then sometimes they get resistant to the spray, and either we have to up the dose or we have to switch to something different.
Very true.
There are nasal antihistamines that are also used as well that we can use. Astelin is one brand that just comes to mind immediately.
Very true. Do you think that it's possible to outgrow allergies as a child gets older?
Some do. Some children do outgrow their allergies. Just like asthma, there's some children who outgrow it. Others, unfortunately, that it can get worse. And in the area that we live here, we have a lot. Allergies tend to get worse a little bit as we get older.
So with each season, it's kind of like your body taking a hit.
Yeah, essentially. Some children do get out of it, though. But also, if children really have a lot of problems with their allergies, sometimes they require a special kind of medication that's administered through a shot. It's called immunotherapy. What essentially is done, and this is done through an allergist, is that their bodies are exposed to a certain certain allergen over small doses, and it helps their body to essentially get accustomed to that particular allergen and hopefully help to overcome the inflammation, and hence make the body sort of realize that particular allergen is not bad for the body, and sort of trick the body into essentially accepting it as normal and not setting off the whole allergic cascade that goes through.
So what children do you recommend for the allergy shot procedure?
Well, the allergy shot procedure would be for any child that is not having relief even with long-term prescribed medication. Other ones too that would be a good candidate for immunotherapy would be those that have especially dangerous reactions, because the severity of allergic reactions can be as mild as a runny nose, a sniffling nose, to as high as a system of a constellation of symptoms that we call anaphylaxis, where the child has swelling in the throat, swelling in the face, difficulty breathing, even effects on the blood pressure and blood pressure and heart rate. If a child is showing these kinds of symptoms, first of all, if they show symptoms immediately, they have to immediately go to the hospital to be seen or to see their doctor immediately.
Absolutely.
But for children like those, they may be also candidates for immunotherapy.
No, absolutely. That sounds great. Well, let's just take a short break, and we'll be right back with Dr. Emmanuel Martakis. Welcome back. I'm here with our guest, Dr. Emmanuel Martakis, and we're currently discussing seasonal allergies. And actually, just when we were on our little break, we were talking about what do you do as an adult?
So a lot of the things, some of the conclusions we came to, and some of the things that we would definitely recommend. For adults, a lot of the same problems can translate from children. The big thing really you have to also see is the air in your house dry. Houses with forced air heat, wood stoves, they will have people with a lot more allergic problems for the simple reason.
We see that all the time because it come through the office, even this morning.
Yes, yeah, we did. It's something to actually see a lot of people. I mean, of course, they require wood stoves in order to keep the house warm. Unfortunately, now you're setting up a situation where your humidity will actually go down to as low as 20 or 10%, and that can actually cause nosebleeds to happen. So what I would recommend would be either a humidifier in the bedroom where the child's sleeping or where you're sleeping, or if there's a problem getting one of those, then the other thing that you can do, which I know I used to do when I was a child, was just take a saucepan, fill it with some warm water, and just leave it on the nightstand overnight.
Nowhere near where a little child can get into it.
Right. You don't want them to pull it onto themselves or anything like that. No, you don't want that.
No. And what are some of the medications you recommend, even as an adult?
Even as an adult, there's some great nasal saline preparations that you can use to try to clear out your nostrils, especially for a lot of the mucus that you get in your nose.
I know we spoke briefly about the neti pot for kids. What do you think about it for adults?
Well, for adults, I think they may be able to have it. They may be able to take it a little bit better. It depends also on the adult.
Have you ever tried it?
Yes, I did.
And what did you think?
I thought it was all right. It feels funny going up one side and out down the other. I mean, basically your nasal cavity anatomy, you've got a whole big opening in the back where essentially the water goes up one end and comes down the other end. So that's
definitely not for me, but for those who can tolerate it, I guess.
I found it was great, but I also use the squeeze bottle myself to have better control over the insertion of the water. But the other thing though too that's important to also realize too is that for me I also take an antihistamine myself, just a regular Claritin for myself, just to help.
Do you take that every day, or is that something you start once allergy season hits?
I usually start it once allergy season hits. Once I start feeling my nose getting sniffly, then I start to take it. And usually you have to take it every day for at least a couple of weeks, because to take it just once, you're not going to really get that instant effect. It's not designed to be a suddenly instant effect. You have to take it for about 2 to 3 days before it really starts to have an effect.
And is that how you advise parents too who come in?
Absolutely. I find too many times people get impatient. They wait one day and then they say that it's not working and they demand something more strong. A lot of times it's not necessary, because if you give the medication a chance to work, it will work.
Yeah, and to really build up in the system, you have to take it for at least a couple of days. And usually I tell people, let's try it for 2 weeks, and we'll bring you back in 2 weeks just to see.
Exactly. 2-3 weeks is a good time. You can see whether it's working or not. If it's not working by then
we can switch it out to something else. But if it is working, great.
Exactly. No, that's definitely a great. It's a way that we treat hay fever in our office, and it's a good way for people to apply it even at home.
Yeah. No, absolutely. And now for our children with asthma who also suffer from seasonal allergies, we start those medications typically at the onset of allergy season. Now, with Singular, do you keep that on board all year, or is that something you start with allergy season, or what is your take on that?
Well, I always find that the less medications, the better. But if a child needs to have the Singular on board, because Singular is FDA approved for both asthma as well as for allergic rhinitis, if they need the medication, then they need to stay on it. But if we can try to take them off of the medication, then...
To give them a little break during the wintertime?
Precisely. Or even during the summertime. It depends also on when their allergies hit and also when their asthma hits as well. Wintertime is usually a really bad time for asthma, while spring and the fall is usually a bad time for allergies. But once again, if we can try to find a vacation time to get them off of the medications, that's always the better approach.
And is that similar to Zyrtec or Claritin, where it takes a couple days to really know the effect?
The actual mechanism of its therapeutic goal is not the same as an antihistamine. It's what they call a leukotriene inhibitor. It helps to inhibit some of the natural inflammatory cascades that happen within the body during an allergic reaction. But it does take a couple of days to work as well, usually about 3 or 4 days for Singular to really kick in.
Okay, great.
Yeah.
So I know we also wanted to touch a little bit about food allergies to tie that in, because we do see quite a bit in our office. I know we talked a little bit about the blood testing for cat dander, dog dander. You can also test for dust mites. Yes. Now, can you test for food allergies via the blood work?
Yes, you can. There are special RAST testing for, RAST is a R-A-S-T. Not quite sure what it stands for. I kind of forgot. But there are blood tests that you can check for all sorts of things. You can check it for all kinds of tree nuts, hazelnuts, peanuts, cashews. You can also check for shellfish, lobster, clams, oysters. You can check for different kinds of meats, between beef, fish, chicken. You can also check for different kinds of fruits, which a lot of children can have allergies to. Strawberries, peaches.
What about milk?
Milk, yes. Milk protein especially. Basically, anything that has a protein in it that the body can react to is a possible suspect for allergies.
So now with children with food allergies, is it like an allergic rhinitis, or is the presentation of a food allergy completely different?
Nah, it's much, much different. Usually what you'll see with children, especially for mild allergies, you might see like a rash around the mouth. You may start to see a rash forming on the chest, on the arms, the legs. On more severe allergies, you may actually start to see swelling in the face, the eyes, the neck. You may start to see swelling in other parts of the body too.
And you
like
can even
hands.
go into that anaphylaxis like we were talking about with seasonal allergies, correct?
Absolutely. In fact, that's something we always worry about with anaphylaxis, and especially with food allergies. That's why now schools have been taking such an initiative to try to separate out children, for example, with peanut allergies, because peanut allergies is the most common food allergy there is. That, and then there's milk, and then shellfish. So those are the most common allergies. And the children with peanut allergies, sometimes some children can literally become, even if they say touch peanut, they can actually go into an anaphylactic shock. So that is it's a very big problem, and it's something that the schools, I know, they take care of by having, say, peanut-free tables where nothing that's peanut that has peanut in it, peanut butter, granola bars with peanuts in them, or anything like that, or even sometimes foods
peanut oil.
Yes, peanut oil, foods that are made in the processed in the same factories where they process nuts and other tree nuts, peanuts and tree nuts.
So besides avoidance, with someone who has a severe allergy and say they go into an anaphylaxis, how do we treat that?
Usually what is done is we prescribe a medication that's called epinephrine. It's a medication that you usually give. It helps to blunt the allergic cascade that leads to anaphylaxis. But this is this is in a medication that's in an injectable form. We call it the EpiPen because it's about the size of your usual ballpoint pen. And what it essentially is that it delivers an injection. Usually you basically stab the kid with it right in the thigh, and it gives an intramuscular shot of epinephrine, the epinephrine junior, and then they're for small children below 30 kilos and above 30 kilos, it's just regular EpiPen. And this is the medication that you use as a rescue medication. You don't just use it if the kid's starting to get a little rash or, I don't feel so good. This is usually something that you reserve for those children who are very severe. So these are the children that are having difficulty breathing, swelling in the face and the mouth. Then you give them the EpiPen. But usually anywhere that you're giving the EpiPen, you should also be calling 911 because then they have to go to the emergency department. Absolutely.
You want them seen by a healthcare professional at that time. I completely agree. So now I know we touched base on peanuts, But at what age do you recommend certain foods for children? So peanuts, at what age would you say is fine to try that?
Usually I would say at least above the age of 2, but even 3 or 4. The biggest reason why I usually don't really allow peanuts at such a young age is simply that peanuts are also choke foods.
Oh, absolutely.
They're little young children. They don't have that the discipline to be able to chew food properly. So a lot of the things that are choke foods, peanuts, popcorn, the big bits of raw apples, stuff like that, the children grapes, hot dogs. They don't have that discipline to chew the food really well, and they wind up choking on those things. So just by dint of it being a choke food, I usually hold off until at least 3 or 4.
What about seafood? What is the age recommendation you have for parents?
Above 2 years old, at least. Above 2 years old. So no shrimp, no oysters, no clams.
So basically shellfish?
Shellfish, exactly.
What about other types of fish?
Fish in general, I would say above the age of 1, you can start giving bony fish. There has been a new concern about the amount of mercury that has been in fish, especially ocean-going fish such as tuna, swordfish, mahi-mahi, things like that. They used to be safe for children to eat. Now I'm not so sure, just by dint of the mercury level. So if you do want to give bony fish, trout is okay, salmon is good. Those have low levels. Cod also has a pretty low level of mercury in their flesh as well. So those
and they're also a good source of omega.
Absolutely, absolutely. Mm-hmm.
Now, what about eggs? Do you recommend an age cutoff for that or an age limit to try it?
Well, the age limit really for eggs, for the most part, egg yolks are okay after the age of about 7 to 8 months old. And upward to try, you can try out the egg yolks. If they do okay with that, then I think you're pretty much safe with that. But usually hard-boiled eggs are good because once again, it's the issue of whether or not the choking hazard.
And I know I get this question all the time, and I'm sure you get it as well, is when a mom tries to introduce foods to a baby. So how do you recommend food introduction to, say, a 4-month-old who's never had anything?
Well, pretty much for every child, you should always give about 4 to 5 days at least on any new food. For the simple reason, if the child shows any kind of allergic reaction, that can include a rash on the face, rash on the chest, or even, heaven forbid, swelling in the neck or swelling in the throat, then you know what it is, and then you can stop it. That's really the big reason why we have that sort of limit. Because if you start a child on 2 or 3 different foods, now you're scratching your head on what started it, and now you have to go back and try each one at a time. And that just delays the introduction to foods that much more.
And at what age do you advise parents to start introducing foods?
I would advise it at 4 months old. There has now been a lot of talk on what kind of foods can be introduced. Initially, the way I was trained, it was essentially you start with your grains, oatmeal, then rice cereal first, then oatmeal, then barley. Then after that, you can start on a vegetable or a fruit. But even now, there has been talk about introducing meats a lot earlier into children, even as early as 6 months, for the reason of introducing more iron into their diet. But once again, that's all still controversial. So for now, I would still recommend vegetables first and then fruits.
And then give it a few days and then slowly start to add in everything else.
Absolutely.
All right, great. Well, we're going to take a quick break. We'll be right back with Dr. Emmanuel Martakis. Welcome back. I just want to say thank you to our guest again today, Dr. Emmanuel Martakis, for his insight on seasonal allergies as well as food allergies. So thank you.
Thank you so much. It's a pleasure as always, Sarah.
Great. And for families who are suffering with seasonal allergies or food allergies, please feel free to stop by and see us. We are located at the Port Jervis Center for Pediatrics at 140 Hammond Street, where walk-ins are always welcome. I'd like to say thank you, everyone, for tuning in. Hope you have an active, healthy, and allergy-free week ahead. I'm Dr. Sara Little, and I'll see you again next week.
If you have questions for Dr. Sara, you can email her at drsara@middletownchc.org. That's Dr. Sara, S-A-R-A, at middletownchc.org.